On the Medical Watch now, the Trump administration has set new requirements for COVID vaccines in healthy adults and children. It's a major new policy shift by the White House. The annual shots will no longer be routinely approved, but will face a more stringent set of guidelines requiring more evidence for new shots for healthy adults and kids. Dr. Emily Landon is the executive medical director for infection prevention and control at the University of Chicago. And there she is. She's joining me now to talk a little bit more about this. Let's start with why the Trump administration may be making these changes.
Well, that is a very difficult question to answer. I'll say that it's a little bit confusing to me why they want to turn down the recommendations on these booster shots. I know many people have not necessarily been getting all of those booster shots, but having them available and covered by insurance is pretty important for, I think, all Americans. We recommend flu shots for all Americans 6 months and up. I think the COVID vaccine belongs right there next to it.
But what is the explanation that they're giving as to why they're putting in place these requirements and taking away the ability to get the vaccine for people who are under 65 or children?
Yeah, well, if you have a comorbidity or a medical problem that puts you at higher risk of having COVID or having a bad outcome from COVID, then you will still be eligible for an annual booster. But healthy people will no longer be approved for that. And that means that the shots are literally not approved. And it means that your insurance probably won't cover them for that. Their reasoning is a lot of people don't get them. And we don't really know if they make that big of a difference for people. And so we want to study it in a randomized controlled trial in that patient group. And all of that sounds pretty good on the surface, but I don't really think that it's sound medical reasoning.
Okay, so they're saying that they may require these additional studies by drug makers in order to approve the vaccine for, as you said, anyone under 65 years old and without a medical condition. How difficult do you think that's going to make it for the average person to obtain the vaccine?
It might be difficult. You might have to pay out of pocket. And I don't think that there's any need to even do those studies. So it's diverting money that drug companies could be using to sort of spend on new drugs, different drugs, trials of things that we really need in other areas. They have to spend a lot more money in order to be able to continue giving COVID shots or making COVID shots available to healthy people.
So if the drug makers do more clinical trials, what were they not including in these clinical trials before that they would include now? I guess what would the difference be?
There isn't a big difference.
Okay.
So the difference would be that they would be doing head-to-head placebo-controlled blinded studies as opposed to during the pandemic when we just gave people the vaccine and then the people that didn't get the vaccine were considered to be non-vaccinated, and we used population-based studies. In these studies, it would be a group of people that would be followed, and you might get an injection of saline or an injection of COVID vaccine, and then you'd be followed over time to see if you had better or worse outcomes after having gotten the vaccine. The problem is that we know from the earlier studies that even individuals at low risk of COVID can have bad outcomes from COVID. And so those individuals are definitely protected when they get the COVID vaccine. And there's very little harm done by the COVID vaccine. It seems to me that the main reason for non-uptake, or the reason that a lot of people aren't taking the COVID boosters regularly, is because of a lot of propaganda and misinformation, either saying that the COVID shots are not effective or saying that they are maybe dangerous, which they are definitely not, or that that COVID is no big deal. And I would say that all of those things are incorrect.
All right. Dr. Landon, we appreciate your time and helping us sort of navigate this whole world and understanding what's going on. Thank you.
Well, good luck.
All right. We'll talk again soon.